More than 30 million people can now get a second COVID-19 booster. The FDA and CDC approved the dose for people 50 and older and anyone with a compromised immune system. Dr. Shalika Katuga, with Baptist Health joins us live via Zoom this morning. Doctor, what should people consider before getting a second booster shot?
Sure. Good morning. Thank you for having me. So it is correct. On March 29th, last Tuesday, the FDA authorized and the CDC then gave a green light for individuals who are over 50 to get a second vaccine booster 4 months after their initial, or individuals with certain immunocompromising conditions to get it who are over 12. So first off, let me say that only 50% of eligible Americans have gotten the first booster, and the data for the first booster is more robust than for the second booster. So if you're in that group and have not gotten the first vaccine booster, then let me by all means urge you to go get that. The data is much more robust and sound. So boosters are very safe. Now, when you come to think about a second booster, it's actually not like the primary series or the first booster where it was strongly recommended, urged, there's plenty of data. This is actually more of an individual type decision. And factors to consider are age, underlying medical conditions, timing, and other risks. So if you are over 65, then you are high risk of having severe outcomes of severe COVID-19. So I would strongly urge anyone over 65 to go get a second booster. If you have certain underlying medical conditions, if you have underlying heart disease, lung disease, kidney disease, diabetes, obesity, pregnancy, or a combination of these diseases, well, then certainly you are at higher risk of severe outcomes, and you should consider going to get a second booster. Now, timing. These boosters last or give immunity for about 4 to 5 months. So really, we are in a nice low right now in Florida and in the country. So maybe wait until the surge is a little bit more, or if you just had Omicron infection, then maybe you don't necessarily need the fourth dose or the second booster right at this moment. So timing is an issue. And then we all know that in the fall, respiratory viruses surge. So again, timing. And then other risk factors. So if you, for example, work in a hospital or work around individuals with COVID-19, or if you're planning overseas travel or, travel for work, well, then those may be factors. So what I would suggest, since this is an individual decision, is if you are not certain where you stand, to speak to your healthcare provider to have them help you decide when is the right time to get this second booster.
And when can people locally start getting these second boosters?
So retail pharmacies say that these second boosters should be available as early as this week. So you can probably go on in starting Monday.
Okay. And I know you kind of addressed a lot of the concerns that people have, but are people ever worried about the second booster? Have you spoke with a few patients who are still on the fence about getting it?
Yes, and not even just the second booster, but the first booster. What I would say is certainly go out. If you haven't had your first booster, I recommend that wholeheartedly. Go out and get that. In this, just to give you some data, in this last Omicron winter surge, people who were boosted with the first booster were 21 times less likely to die than those who were unvaccinated, and 7 times less likely to be hospitalized. So I definitely say your first booster. The second booster, what I really hear is, do I really need it right now? And that is a very fair question because, this was a green light, but not a full recommendation. And again, it is individual, and experts are a little bit divided still on whether or not to get it. So that is more of an individual decision. And I would definitely say focus on you, your risk factors, and timing.
Okay, so take your time before making a decision. All right. Well, thank you so much, doctor. Thank you for joining us again.
Thank you.